The state's chief medical officer says this is one of the final steps before the FDA can grant the emergency use authorization that allows the vaccine to be shipped to the states. She mentioned that Indiana is expecting arrival next week. During Governor Eric Holcomb's weekly COVID-19 briefing, Indiana Department of Health Chief Medical Officer said a Food and Drug Administration subcommittee is expected to approve the first COVID-19 vaccine on Thursday. This approval is one of the final steps before the FDA can grant the emergency use of authorization that allows the vaccine to be shipped to different states. Initial doses will go to the 5 pilot hospitals, which includes Parkview Health Regional Medical Center. Additional doses are expected to be available at a total of 50 hospitals by the end of next week.
These vaccines will go to frontline healthcare workers who are at risk of exposure to COVID-19 while providing direct care to patients. This includes hospital staff and employees of long-term care facilities.
Indiana is expected to receive around 55,000 doses and should receive additional vaccines each week, but the amount is unknown.
Other national experts recognize the importance of prioritizing vaccinating our vulnerable populations. We recognize that many members of vulnerable populations also are essential workers, so we anticipate that there will be overlap among the groups when we reach the next phase.
Right now, the vaccine is not for the public, but we still asked you on our website, would you consider being vaccinated? Half of you said no. Now here's the list of all the pilot hospitals. Frontline healthcare workers and long-care term facility workers will be priority until going into January. It's still not determined who will receive the vaccine after the frontline healthcare workers. In studio, Brianna Brownlee, Lane 15 News.